Hello, my name is Mark Rothstein, and I'm pleased to give you another update on COVID-19. This is the third one that I'm doing this year. The first was in January, second in August, and now with my sort of year-end review, I want to talk about the new issues raised by the Omicron variant. Before I start, I need to go through my usual list of disclaimers. The first being, I'm not a physician and I'm not providing medical advice. You should consult with your own doctor if you need medical information or treatment advice. Second, I'm not a virologist or an epidemiologist. My expertise is in public health law, policy, and ethics. I started working on coronavirus policy in 2003 when I was the lead author of a report commissioned by the CDC on what the US should do to prepare for the next coronavirus epidemic, which we have certainly right now. Finally, as you know, the science keeps changing, and my goal is to provide you with up-to-date information that's up to date as of today, which is December 27th, 2021. My talk will be in three parts. First, I want to discuss the risks of the new Omicron variant. Second, I want to try to answer the questions that were sent to me regarding Omicron and COVID in general. And third, I will take up the question of how long will this pandemic last? And it's the same question that I ended my first two talks with, except the answer is a little different this time. So what about this Omicron variant? The most striking thing to me about Omicron is how quickly it has emerged. The first case was reported by South Africa on November 24th, and the first confirmed case in the US on December 1st. Now, less than a month, it has largely replaced the Delta variant in terms of new infections, although there are still about 55,000 people hospitalized with Delta in the United States, many sadly in very serious condition. We often hear that Omicron is milder or less severe than Delta. That means that of the people who test positive and are infected with the Omicron variant, there seems to be a lower percentage of hospitalizations and deaths with Omicron than Delta. But at the same time, Omicron is known to be 3 times as infectious as Delta. So how can that be? Well, infectivity or transmissibility is a way of calculating how many other people an infected person will infect. And it's based on 3 factors. First, the duration of infectivity after the individual is infected. Second, the likelihood of transmission per contact between an infected person and a susceptible person. And third, the contact rate. So even though there are fewer serious cases with Omicron than Delta as a percentage of infected people, because Omicron is 3 times as infectious, there could be many more people who are infected, and the number of cases of hospitalization or even death could approach or conceivably even pass that with Delta. We don't know exactly how this will play out because the first cases of Omicron are, only a few weeks old. One thing we need to keep in mind is that recently the United States just passed 800,000 in total COVID deaths. And this number is for deaths directly caused by COVID. There are many more indirect deaths. That would include people who can't get treated promptly for heart attacks or strokes because the ICU beds are filled with COVID patients. Another example where has an indirect impact is where people defer checkups or treatments for cancer or other serious diseases because of possible COVID exposures in healthcare facilities. And also people in nursing homes whose COVID isolation and depression causes a rapid decline in their physical and mental health. According to my calculations, and only counting directly caused deaths, today a person dies of COVID in the United States about every 45 seconds. So second, I want to talk about the questions that I received about Omicron and COVID in general. These are great questions, and I hope I can answer them for you. So first, in getting a booster shot, should I get the same vaccine or a different one? Well, if you had an mRNA vaccine, which would be either Pfizer or Moderna, you can get either one, whichever is available, with no problem. If you got a J&J vaccine, Johnson & Johnson vaccine, there has been a concern that certainly one dose of this vaccine was not as protective as the 2 doses for Pfizer or Moderna. And some advice was given that you should get your booster as a Pfizer or a Moderna booster. A new study that just came out suggests that the J&J booster was more protective than earlier studies had estimated. So that's good news for people who can only get J&J because they have a rare allergic reaction to an ingredient in the mRNA vaccines called polyethylene glycol. I want to emphasize how important it is to get a booster. After 6 months, the antibodies to COVID wane, and with it, your protection. And as of today, less than 1/3 of people who have been fully vaccinated have received a booster. I also think that it's likely that CDC will soon change the definition of fully vaccinated to include having a booster. So next question, can you get a booster and a flu shot at the same time? Yes, I did with no problem. And I've seen no evidence that there are any adverse reactions by having them at the same time. Next question, is there a risk in socializing with other boosted people? I think the risk is low with a small number of people who are known to be not only boosted, but careful in their exposures. For other gatherings, even if you are boosted, I would avoid crowds in indoor settings and wear a KN95 mask. Next question, are the rapid tests accurate for Omicron? Yes, they measure whether individuals have infection at a level that would be infectious to other people. The other major kind of tests that you hear, the PCR tests, they are considered the gold standard for use in clinical settings, but they measure detectable virus, which is so low that it might be measuring a virus that does not constitute a risk of transmission. It's overly sensitive for a screening test. So rapid tests, I think, are perfectly fine to use. Next, is it safe to travel by plane if you are vaccinated and boosted? I think the answer is yes, in theory. And the reason I say that is because planes have excellent ventilation. And if you have the vents open and keep your mask on, the risk is low on the flight. But some people don't use their masks properly, and they don't keep distance while waiting at the gate or waiting for their checked luggage. So there are some risks, although I think they are small. If I had an important trip to go on that could not be postponed at this point, I think I would still go. If you can get a rapid test, I recommend that you get tested as close as possible to your departure date. Then after your trip, especially if you have possible COVID exposure, get tested about 3 days after you return. And then assuming the test is negative, follow it up with a second test the next day. That's because the incubation period for Omicron is about 3 days, which is less than Delta, and perhaps one of the reasons why Omicron is more infectious. Next question. How likely are you to become infected if you are fully vaccinated and boosted? The risk is still low that you will become infected, even if you are fully vaccinated and boosted, but not zero, especially with the Omicron variant. The risk is very low that you will become sick and need hospitalization. And the risk is extremely low that you will become infected and die. So low that you will become infected, very low that you will be very sick and need hospitalization, and extremely low that you will become infected and die. But each of these risks need to factor in your overall health status, your age, et cetera. And getting the booster shot now is tremendously important for some populations. For example, the booster rate in nursing homes is less than 25%, and that is very concerning. Question, is it safe for individuals to be unmasked on film sets or other performing settings if they have a negative test on a rapid test that day? So if they are fully vaccinated and boosted, I believe it's safe. If they are not vaccinated, then it is not safe. Rapid tests are accurate for screening as a backup to vaccination, but not in place of it, especially when individuals are in close proximity for a fair amount of time and there is speaking and singing or other exposure to respiratory particles. So individuals who are unvaccinated, but who are deemed qualified for a reasonable accommodation for a medical or religious reason are not able to be accommodated in an unmasked setting where there is close contact. Next question. Is there a connection between vaccination and elevated blood pressure in older men? I can find no evidence of this connection, so I would say no. Next, what is the correct length of time for quarantine? The CDC recommends avoiding contact with other people for 10 days. But because of the acute shortage of healthcare personnel, on December 23rd, the CDC issued a new recommendation that healthcare personnel can quarantine for 7 days and return to work after a negative test. I also think it's possible that the 7-day period will be extended to everyone, but it has not been extended that far yet. So third, the question that everybody wants to know, and I certainly am at the front of the line in wanting to know the answer, when will the pandemic end? In South Africa, where Omicron arose, it appears that the sharp increase in cases seems to be slowing just as fast and for reasons that nobody really knows. It's possible that in the US, there also could be a steep decline after the Omicron outbreak peaks, but we haven't reached that yet, maybe in a month, but it's certainly hard to predict. I don't know whether we would follow South Africa's pattern or not, because every country is different in terms of exposures and mitigation strategies. And what would happen if Omicron receded? Would there be a new variant that would arise? Would Delta re-emerge? Nobody knows. So in the short term, we will have to rely on vaccination and boosters, more frequent rapid tests, masks and social distancing, and some new therapies. For the long term, many experts are predicting that we will never be over COVID, that it will be endemic, which means it will come back periodically, much like seasonal influenza. Still, there would be two issues. How often does it come back? And how severe will it be if it does come back? And again, it's difficult to say. Well, I've got 3 items of good news to report, and I've saved them all for last. There are 3 items of good news that I've got to report, and I've saved all 3 of them for last. First, 4 effective therapies are on the way. As we all know, there have been numerous COVID treatments tried over the last almost 2 years of the pandemic. Some were plausible or somewhat effective. Others were scientifically baseless and dangerous. Monoclonal antibody treatment is one of the few treatments that's proven to be effective. Unfortunately, of all the monoclonal antibodies that we had available, only one of them seems to work in treating Omicron, and it's called sotrovimab, SOTROVIMAB, made by GlaxoSmithKline and Verb Biotechnology. And also, unfortunately, it is in short supply. It requires infusion in a hospital, which takes space and human resources, and those 2 things are also in short supply. Recently, the FDA approved 2 oral therapies, and one of them is extremely effective. It's called Paxlovid, Paxlovid, made by Pfizer. And I hope that one day somebody will make a drug whose name I can actually pronounce. At any rate, after a positive COVID test, you take twice a day for 5 days at home. And you need to start it within 3 days after infection. But in clinical trials, it was shown to reduce a patient's viral load by 10-fold. And that is really significant. Second, AstraZeneca has developed a drug called Evusheld, EVUSHELD, for pre-exposure prophylaxis for immunocompromised individuals. It's an injectable monoclonal antibody cocktail for individuals such as transplant recipients and people with autoimmune disorders who cannot make the antibodies after vaccination necessary to prevent being infected by SARS-CoV-2. It received emergency use authorization from the FDA on December the 9th. Third, preliminary work has begun on developing a universal COVID vaccine that would be effective with any current or possibly emerging variant. The universal flu vaccine is in clinical trials that were begun in 2019 that could replace the yearly flu vaccine, which often is only moderately effective. It's not known yet whether the universal flu vaccine works, and it took 10 years to develop. So efforts are being ramped up to support accelerated research for a universal COVID vaccine, and it's unknown if they're going to be able to come up with one, and if so, how long it will take. So even though things still seem frustrating, disappointing, or even bleak, it's clear that we're in a lot better shape than we were on August 7th, my last COVID update, which focused on the Delta variant. So thank you for your questions. If you have additional questions, 2 very good sources are the websites of CDC and CNN, and both links are in the description box. So I wish all of you a safe, healthy, and happy New Year.